Have you ever noticed changes in your size or firmness during intimacy? Maybe even quietly wondered if something's slipping away and wish there was a natural way to turn things around? I'm Dr. Masha, and I'm here to help men over 60 finally understand what's going on inside their bodies and how science-backed training can restore strength, control, and confidence in just a few minutes a day. But first, please like the video. The more people like it, the more YouTube will distribute it to people who don't have access to doctors or hospitals. Also, please share the video with your friends and family. Many lives can be saved with your help, so share it. What I'm about to share isn't a gimmick, a pill, or a surgery. It's an approach that taps into your own body's hidden muscles to naturally boost firmness, stability, and even the way your size appears, no matter your age. For so many men, aging quietly brings a list of frustrations: erections that don't feel as strong, a downward angle that wasn't there before, or a look that just seems smaller. It's easy to point the finger at hormones or chalk it up to just getting older. But the truth? There's a powerful mechanical part of your body almost no man trains, even though it's essential for sexual performance. Today, we'll explore those hidden muscles, uncover how they work, and walk step by step through a 3-minute daily routine that can transform your function and confidence. Inside your pelvis lies a network of deep, supportive muscles called the pelvic floor. Among them, two are the true MVPs when it comes to erection quality: the bulbocavernosus and the ischiocavernosus. These muscles have one mission during arousal: to trap blood inside the erectile chambers and keep it there under pressure. The bulbocavernosus squeezes the base of the penis, clamping veins so blood can't escape. The ischiocavernosus reinforces that pressure, holding the shaft upward and maintaining the angle men associate with youthful erections. When these muscles weaken, whether from years of sitting, reduced activity, surgery, or simple disuse, blood slips out more easily. Erections feel softer, fade faster, and lose that proud, lifted angle. And this isn't just theory. A 2005 randomized controlled trial in BJU International followed men with mild to moderate erectile dysfunction. After 6 months of targeted pelvic floor training, more than 40% regained normal erectile function without changing medication, and another 35% saw major improvements in firmness, control, and satisfaction. Why? Strong pelvic muscles improve something called venous occlusion, the internal valve system that holds blood in the penis. Better closure means more pressure, more stability, and longer-lasting function. After 60, several factors speed up pelvic muscle decline. Long stretches of sitting can literally switch these muscles off. Prostate surgeries can interrupt nerve signals. And natural age-related coordination changes mean even if the muscles are there, they might not activate at the right time. The results aren't just physical. They can change the way a man sees himself. A flatter angle, less responsiveness, even the illusion of shrinkage. And here's the key: the actual tissue length hasn't changed. It's the loss of internal pressure that makes it look smaller. The good news? You can retrain these muscles at any age, no gym, no drugs, and see improvements in weeks. Now, let's be clear, pelvic floor training won't add anatomical length. But by boosting blood flow and pressure, it fills the erectile chambers more completely, creating a firmer, fuller appearance. There's also a powerful mind-body effect. Contracting these muscles correctly sends stronger signals to the brain. Men often report feeling more connected, more in control of rhythm, and more pleasure during intimacy. This isn't just about performance, it's about reclaiming a sense of ownership over your body. Before you train them, you have to find them. The easiest test: while urinating, try gently stopping the flow midstream. The muscles you feel working without tightening your legs, abs, or holding your breath are part of your pelvic floor. Do this just once to locate them. Regular stopping can harm bladder function. Now here's your foundation routine. Find a comfortable spot, sitting or lying down. Take a few natural breaths. Gently contract your pelvic floor muscles as if lifting something inside. Hold for 3 to 5 seconds, then release completely for another 5. The release is just as important as the squeeze. Repeat 10 times. Aim for 2 or 3 sets daily, spreading them out morning, afternoon, and evening. You can even do them while watching TV or reading. Avoid common mistakes. Don't squeeze your thighs, butt, or abs. Don't hold your breath. Don't push down. Think gentle lift. This isn't brute force training. It's control, coordination, endurance. The first wins are often subtle. Better muscle awareness, easier activation, more stamina before the visible changes. Once you can isolate these muscles, move to neuromuscular control, training your brain to recruit them instantly when needed. Some men use biofeedback tools or apps to get real-time activation data, which can speed up progress. Without gadgets, practice quick rhythmic squeezes and full releases. This builds rapid response strength for the moments that matter most. Here's what most men see. Weeks 1 to 2, stronger awareness even if contractions are weak. Weeks 3 to 5, longer hold times, easier engagement. Weeks 6 to 8, a noticeable lift in angle and stability, more control during intimacy. Weeks 10 to 12, a fuller look, greater firmness, and renewed confidence, especially if blood flow was holding you back. The side benefits? Better bladder control, prostate support, even reduced risk of pelvic organ prolapse. Low risk, no drug interactions, anywhere, anytime training. For men avoiding medication or struggling with side effects, this is a safe first step. I'll share a story. Mr. T, 68, came in frustrated, reliant on pills for every intimate moment, worried about the side effects. We built in a simple 3-minute morning routine. 10 weeks later, he said, for the first time in years, I felt in control. No pill, no planning, just me, confident again. That change wasn't magic. It was muscle. Like any exercise, more isn't always better. Overtraining can cause tension or discomfort. If you notice pain, urinary changes, or anything unusual, see your doctor. Most men over 60 can safely start this with physician clearance. Once the basics feel natural, add progressions, long holds, build from 5 seconds to 10 with full control. Quick pulses, rapid 1 to 2 second contractions, and releases to boost reflexive strength. Functional practice, engage during stairs, lifting light weights, or standing up, so the activation becomes automatic. The bonus, strong pelvic floors often mean better posture, less back strain, more energy, because these muscles are part of your body's core support. And long term, you're investing in urinary control, post-surgical protection, and intimacy confidence for years ahead. Performance anxiety creates a vicious loop. The more you worry, the harder it is to perform, and the more the muscles forget their job. Training breaks that cycle. When firmness, angle, and control improve, the mental weight lifts, and that confidence changes everything in and out of the bedroom. James, 72, told me he'd stopped initiating intimacy because he didn't trust his body. 3 months into training, he not only regained reliable firmness, he said his relationship felt alive again. It wasn't just his body, it was how he saw himself. Let's recap. Strong pelvic muscles trap blood longer for firmer, more stable erections. Neuromuscular control means you engage them at the right moment without thinking. Fuller appearance and improved sensation restore physical and mental confidence. Side benefits: bladder control, prostate support, injury prevention. Leave them untrained, they'll keep weakening. Start now, and in weeks, you could see life-changing results. You've just learned one of the most effective natural ways to reclaim firmness and confidence after 60. But there's another side to the conversation most men miss: how your daily self-stimulation habits can affect your health and when to talk to a doctor. In the next video, a urologist explains how to masturbate safely after 60 and when to seek medical help, how to keep it safe, avoid hidden risks, and spot signs your body needs professional attention. Click here to keep building your knowledge and protecting your health. I'm Dr. Masha, and thank you for joining me in this step toward better male health. This video is for education only, not a medical substitute. Always consult your healthcare provider before changes. See you in the next video.